makes no sense whatsoever. That while in other parts of the world the numbers are coming down, here in Ghana we're registering an increase in infections. 50 new infections every day. By the time this show ends, we would have had 8 new infections in Ghana.
Terrible.
And one of those infections could very easily be you or someone you know, someone you are about to meet and engage in intercourse with this week could be infected this morning. And it's just because of the drastic shift in our behaviors, in our attitudes towards sex and towards HIV itself. So today I think there's no better person to help us with this conversation than the Director General of the Ghana AIDS Commission himself. And he's here with us. Doc, good morning. It's so nice to have you.
Good morning. And thanks for having me.
That's right. Dr. Chreme is no stranger to our show. And it's always good to have you, Ms. Dr. Chreme Itiahene. Okay. Now, maybe we'll start from the very beginning. I remember what HIV was when we were growing up.
Yes.
It was the scariest thing to ever happen to humanity. Yeah. Please, is it still the same scary disease? Or is it now just like diabetes and hypertension?
HIV is the same disease that used to scare us so much. I remember when the epidemic started in Ghana, I think even before we found the first case, Prof. Nekwe wrote some booklet on HIV and AIDS. The day I read that book, I wish I didn't exist at that time. It was so scary.
Yeah.
And it hasn't changed. What has changed is that it's now manageable. Unlike previously or at the beginning when we did not have medication. Once a person gets it, there is no chance for him surviving. That person is going to eventually die. But today we have medication that rather prevents people from disease progression and death. And so that has made HIV as a chronic disease. And also the approach we use at the beginning, because it was so scary, they needed to bring out the facts for people to appreciate. And so it looked so scary then. The messages, the materials, educational materials, but now it's all been toned down. And so people take it for granted. But it is the same HIV, the same mechanism, and the end stage of it hasn't changed, except that there is an intervention that allows people to live longer with it.
Yeah. In fact, the first case was recorded here in Ghana in 1986. It was a patient of Professor Nekwe, and the testing was done by Professor William Ampofo, who until recently was running Noguchi. Noguchi became the first center for testing HIV, and now, of course, there are centers everywhere. You can test it, anywhere. But in a conversation with Professor Ampofo in preparation for this show, he was talking about the difference in attitude towards the disease, how it seemed a national alarm when that first case was found, and it seemed like doomsday. Nobody wanted to even risk being touched by this virus. Today, 50 new cases a day. Doc, what are we doing wrong?
A lot of things. We have adopted a certain attitude and behaviors that actually put a number of people at risk. And I will say that, socialization starts from the home. And it appears we are getting it wrong. Because the values of our young people, you wonder where they come from. And a number of things are happening. When you meet young people, the language they use, some of the language, even as at now, I find it difficult to use such language because it's never been part of me. That's not how I was raised up. But it is so common among them. Look at the social media. You see young people, teenagers on social media saying, yamakwan, yaba, yabejimu kununum, so get ready for us.
Wow.
And they're filming.
Yes, and they are filming, and they are so proud of it. And so when the value system goes wrong, you see things like this happening. Now we have quite a number of young women and, of course, young men going into prostitution or sex work, and the way they present it, it comes with glamour, and it comes with some prestige, and still it is sex work. And people who are well resourced will want to patronize them. And unfortunately, sex workers have much higher HIV prevalence than the general population. And so when people use their services without protection, then they are likely to be infected. And these same people who use the services of sex workers have partners. They are probably married. They have several side chicks. And so you see that these 50 people you are talking about, if any of them happens to be one of the 50 people, the wife is at risk, the side chicks are also at risk. And so you see the chain of transmission going from one person to another and another and another. And that is what is creating the situation.
But Doc,
and I'm not saying it is only sex workers who are spreading it.
Except I wanted to dwell on the sex worker part for a second. Some time ago, I read your data, which suggested that, for example, the use of contraceptives, specifically condoms, were very high among sex workers, even higher than the general population.
Yeah.
But you're saying that the incidence rate among sex workers is also very high.
Yeah.
Than the general population.
Yeah.
How so?
It is so because sex workers, they are in business. They want money, right? So if in the first place, not all of them are empowered enough to negotiate safer sex. And some of them also value the returns from that business. And so if a client would want to have sex without a condom, but at a higher fee, they are prepared to do so. Sometimes too, they are molested to have sex without a condom. Some of them even experience violence because they have suggested use of condom or insist on use of condom. So all these things work against them, but they use condoms, and we have, comprehensive program for sex workers. But now the market has become much bigger with a lot of sophistication, and so the service providers may not be able to reach out to all of them because they may not even have access to some of them. And so that is where the problem is. But we should also acknowledge that casual sex, which we know is a high-risk sex, contributes to new infections more than anything else. And so when you combine casual sex with high-risk sex, multiple sexual partnerships, both of which are on the increase, but unfortunately, using condom use during high-risk sex is rather on decline. Unfortunately. And so the new infection, the numbers we are seeing, for me, are the result of the reality on the ground, what we are seeing on the ground.
How do you target that group? So, of course, you're talking about, and we talk here about prostitutes in general, but we may not necessarily be referring to the hookup community.
Yeah.
So that community that sits online, that arranging sexual contact between people, and the person is either delivered to a hotel or delivered to you at home or whichever location. And some of them have their own place. Like you just say them to go and do that. I mean, how do we capture those groupings too as part of the prostitution community, or we treat them differently? Because these are your regular young lady
and a growing population as well.
So they are either in school, they do other jobs, they are actually, but this is what they transition into life with and start on that basis. Do we see them as part of this prostitution group, or we are defining and targeting them differently?
No, they are part of it. It's not only the hookups. We have those who are, we have the escorts. We also have people who live in posh, apartments, and their clients come to visit them. They are all being covered under the program. However, as I said, not all of them are accessible, because some of them are quite discreet in their operations, and so it becomes difficult to reach them. But the method that the service providers use is what we call snowballing. When you reach out to one, she will direct you to another person within their group, and so by and by you are able to reach a much larger number than you started with. But obviously it is not possible to cover everyone. But there is something else that we also have to avert our mind to, and that is the fact that many sexual activities in Ghana are transactional, not necessarily sex work, but transactional. And transactional sex occurs everywhere in our community, in the workplace, in the church, in the even hospitals sometimes.
So for someone who don't understand transactional, what does it mean?
Giving out sex in exchange for something. It can be exchange for job. It can be exchange for, waiving of rent payment. It can be even trotro, a transaction in the trotro and it's happening in our villages where the chiefs are so concerned and saying, leave our girls alone. Stop impregnating them. And here they are referring to the Okadas and the Pragya drivers,
Really?
Oh, yes. Yes. So it's happening all over the place. Transactional sex is one of the major sources of, HIV acquisition in the country. And we need to get people to understand that if, you see, you don't just get into sex, you plan it. It doesn't matter how short or long that time takes, but you have the intention to do it. So if you have the intention to do it, then you must as well have the intention to protect yourself. Get a condom. It's cheap. It's not so expensive. And it is free in the programs we provide. And so why do you put your life at risk when you can protect yourself?
Let's talk about that for a minute. So again, some of the young people we spoke to in preparation for this were explaining to us that the condoms are just not delivering as much pleasure. And I mean, when they calculate the risk of getting HIV, of surviving HIV, because they that's how they think about it. When they calculate the risk of surviving HIV compared to this idea of covering your manhood with this plastic latex contraption, which will erode from the pleasure of the sex, which is the whole point of the sexual activity for them, they find, and by the way, women were saying the same thing. It wasn't only men. Women were saying the same thing. Mm-hmm. When they compare these two, it just doesn't make sense to deprive themselves of the pleasure by wearing these condoms, when ultimately, even if they get HIV, they'll be fine.
Well, you see, when you haven't experienced something, you always assume that it is easy to handle. Mm. And I think that is the point of view these people are sharing. But wait until you get HIV or some sexually transmitted infection. Then you understand whether the need for pleasure actually compares with having to manage a lifelong disease. And so that is my answer to them. I think it's an uninformed view, and they need to reflect. I have a friend, a classmate. I don't have his permission to mention his name, but I believe you'll be proud to hear that I'm using him as an example. This is somebody who uses condom at all times. And he is so used to it, and according to him, he doesn't see the complaint people make about, condoms inhibiting pleasure. He doesn't see it. Even when he got married, it took him a lot of effort to put away condoms. Because he had been using it right from day one. And he would never have sex without using a condom. So, anytime I think about him, I know that those who complain about condom is just the mindset. It's just the mindset. You have, I had an uncle whose wife was always, touted as not having good cooking skills. In their family, it was known. Mm-hmm. But my uncle enjoys her food. And no one dares to complain about it. He enjoys it. And when he's eating, he is actually enjoying it when everybody will complain. So it's the mindset.
That's interesting. We're talking to Dr. Kyeremeh Otuahin. He's the Director General of the Ghana AIDS Commission, and we're all very alarmed at these new numbers coming through. Last year, 2023, we had 17,774 recorded new cases. And Dr. Otuahin, maybe you can help us understand why the advocacy has changed, why the aggression has gone down, why the fear is no longer there.
Yeah, this particular song was sponsored by the U.S. government at that time, All Stars song. And U.S. government actually supported Ghana in a very big way at the beginning of the epidemic. And this is one of the things they did to support the country in collaboration with the Ghana AIDS Commission. Yes, the song, we have to be doing songs like this, although some of the content must change to fit the current knowledge and practice. So we are looking forward to coming up with one if we find the resources. But could you come to think of it, the HIV, when it started, because it was so scary. Donors were willing to put in as much money as possible. In fact, that sometimes they will give you money when they themselves cannot tell what the money should be used for. Because money was, more than enough to deal with the epidemic at that time. But with the new technologies and advancement in science and proven interventions, it has become the needs, the resource needs for HIV has become bigger, whilst the funding or the resources available are rather shrinking. The world is looking at different things now, not necessarily HIV or a single disease. Yes, we are looking at universal health coverage. That is the global goal, one of the global health goals. But it's not looking at it like these are, critical areas of health that require more investment. What they are saying is that, let's have, integration of services through primary health care model, which is a good idea. But I can bet that when the primary health care is brought to scale, if we still do not have the resources to support the programs, a number of them will fall through the cracks. And so it is an issue that we need to consider. And many countries have found ways of filling the funding gap. Now, donors say they will contribute 40% of the HIV budget. Countries must find domestic resources to cover up for the 60%. In Ghana, we are rather having 33% of donor support for the HIV budget, leaving a huge funding gap of about $89 million a year.
Wow.
Now we have done investment case for HIV, and the numbers are, the annual funding gap is getting to about 200 million. And so we really have to see how, since we don't have all the resources we need to provide and, bring all the proven interventions to scale so that everybody can have access to the full range of HIV services in order to achieve the epidemic control and end AIDS in this decade. There should be innovation. And things like this, playing songs, educating the public, it can be a shared responsibility. And that is why the Commission continues to see HIV response as a partnership. Partnership with the media, partnership with the public, private sector, partnership with even individual citizens. And just this morning I was saying on another media platform that if every media house commits to, let's say, giving 30 minutes airtime in a week, just to educate the public on HIV in a week, spread that 30 minutes over, let's say, 6 days. So 5 minutes a day. We can play jingles like this. We have several messages that we have developed. We have several skits that we have developed in all the Ghanaian languages, the official Ghanaian languages, and we have English versions as well. And we can make it available to all the media houses. And if the media houses consider HIV and prioritize HIV as part of their corporate social responsibility, interventions, then we can saturate the air with HIV messages all over the country, because we have more than 500 radio stations, more than 100 TV stations. So it should be easy to do without necessarily asking government or the commission to pay for it.
Right.
So that is how we can go about it. We would want the media to see this. The private sector should also acknowledge that HIV is an industry issue. It's a business issue, because the people who are affected by HIV are those that they depend on as what? Working hands, as their employees. The most economically active population in this country are the ones infected with HIV. And government is providing free services. The full range of HIV services are free in this country. And so if your workers who live with HIV receive free treatment, which gives them, health and life to give you productivity, does it not make economic sense to contribute to that? And so some countries are doing it, and Ghana can also do it. And it is possible for us to end AIDS in this country within this decade if we have the resources. And we can only do so through strong partnerships, all of us taking responsibility.
To put this in proper perspective, how much do we spend on one person, let's say in a year, when it comes to HIV/AIDS, as in taking care of people?
It depends on what you are looking at.
On average,
if you are looking at, let's say, treatment, the cost is different. That treatment for people who live with HIV. If it is prevention, and remember, 98% of the population is HIV negative, and they should be protected.
Maintained that way.
Yes, maintained that way, because we cannot treat ourselves out of the epidemic. And so it depends. But I don't have
treatment.
Yes, I don't have the figures with me at the moment. If I knew, I can provide you that information later on. But we know that it cost us in total about $133 million a year to provide all the services throughout the country.
So $133 million.
Yes.
Dollars, not
Yes.
cedis.
No.
To provide all the services required for the HIV interventions you have in this country.
Yes.
133. Let me do the maths.
Yes.
Okay, so about
That's a huge
133 million
You use a conservative 15 cedi.
dollars, right?
Yes.
$133 million times 15. Jesus Christ. I have to even turn my 1.995 billion. So that's almost 2 billion Ghana cedis, right? And how many infected people do we have on record at the moment?
We have 334,000 and let's say 95.
Okay.
Is it 95?
Okay, 334,095. So I'm dividing that almost 2 billion by that. And you're looking at 5,971 cedis and 36 pesos.
Okay.
Yeah.
That's for a year. But what this suggests to us is that if all the money were going into treatment alone, this is how much it will cost.
That's
precisely.
But we have other components of the program. But even if you look at 2 billion a year, I don't know whether it is actually 2 billion, but if it is 2 billion, in terms of national budget, 2 billion is just a drop of, it's just a drop of water in the ocean. And so it is not something beyond our ability to pay. Okay? It is not beyond our ability to pay. And so all we are asking is that, look, we have everything it takes to end this epidemic this decade.
Okay.
What we need is the cooperation of individual Ghanaians, disciplining themselves and ensuring that they did not contract HIV, because majority is HIV negative, right? And those who live with HIV also taking responsibility for their own lives, that of their family, that of their community, and that of Ghanaians. Because it is only those who have it who can give it to those who do not have it. And so if each one is showing responsibility, we should be able. So that is one side of it. The second one is the funding. And the third is stigma.
I'll come to that. I know you are going to mention stigma. In the United Kingdom, the rule is that if it's casual relations, you are not under any obligation to disclose that you have HIV/AIDS. But if you have a steady relationship with somebody, you are actually supposed to disclose that you have HIV/AIDS. What is the rule in Ghana? If I want to have relations with a woman today, am I under obligation to tell her ahead of it that I am HIV/AIDS positive?
Okay, so in Ghana, we do not have any specific rule, whether in law or in practice, on this particular issue. But what we expect is that anyone who has HIV would disclose their status. And we also encourage that each one of us should have knowledge of our HIV, the HIV status of our partners. So,
even for married couples?
No, for every relationship.
Okay.
For every relationship. And so if you're going to have sex with somebody, it's important you know her status, and she also know your status. If that doesn't happen, then you have a situation of groping in the dark.
Okay.
And if you do not take precaution, then obviously you are exposing yourself to risk of infection. However, it is important that every person living with HIV will take responsibility to protect others. We do not have, in some countries, they have what they call non-disclosure laws. If you don't disclose and you infect somebody, not even if you infect somebody, whether you disclose or not, it's a crime in some countries. We don't have that in Ghana.
Really?
Yes, we've discussed that with the legal fraternity, and their point is that we have other laws that serve the same purpose. And so you do not have to come up with a new law on willful transmission of HIV.
So what they are saying is our existing laws already make it a crime to willfully transmit HIV.
Yes,
okay.
Yes, to transmit or cause harm to another person.
Okay.
All right. And so the challenge we have had is that all the cases that have gone to court, it had been very difficult for the people to prove beyond reasonable doubt that they willfully, transmitted the disease to them.
Right.
I saw mostly because they never test. If you already knew your HIV status and you have your test results before you slept with this person, and you can prove that that person is the only person you had, slept with within the period where you were diagnosed, then it goes in your favor. The ruling goes in your favor, but it's not been possible that way.
Wow.
Let's talk about this strange disparity between the male infections and the female. I mean, about twice as many women were infected last year as men. Out of the 17,774, 11,317 were women.
Yeah.
With only 6,457 being men. What does this mean? I mean, is it not men and women that are having intercourse?
Yeah. Yeah, you're right. It's natural, and we should not be too surprised about it. Every country with generalized HIV epidemic has the same situation. You have more women having HIV than men.
About twice as many?
Yes. In every country where heterosexual sex drives the epidemic. And so there are three factors that I would want to elaborate on. Number one is biological, two, social, three, structural. Now, in terms of biology, we know how the vaginal tract looks. It is a receptacle, and so it can hold up any substance, be it liquid or whatever, for much longer time. It has a wider surface area, and so if there should be some abrasions, and as a receptacle, the seminal fluid remains there for some time, and if unfortunately is contaminated with HIV virus, obviously the virus, will smile its way into the bloodstream because the integrity of the mucous membrane is compromised. In the case of man, the way the penis looks and the skin around it is not as fragile as the mucous membrane of the vagina. And unfortunately, the tissues beneath the mucous membrane of the vagina are also very fragile. And so it makes it very easy for women to contract HIV than men. And in the case of Ghanaian men, we have almost universal male circumcision, and circumcision is being found to be protective.
Right.
That doesn't mean Ghanaian men or circumcised men don't get infected. We have thousands of them who are infected.
Yeah.
But it reduces your risk of contracting HIV. And so these are some of the reasons. There are other reasons we can talk about, but for the sake of time. And one important reason I shouldn't forget to mention, which is also biological, is untreated sexually transmitted infections, especially the ulcerative ones. And so if somebody has chancroid or whatever, gonorrhea, and had not been treated for so long, for men, some of these things is easy to see in an early stage of infection. For women, it may take several years. And so that in itself can raise their risk by between 10 to 13%.
Interesting.
Because, yes, people with STIs in Ghana, the risk of contracting HIV among the people with STIs is about between 10 to 13% in this country. And so there are a number of biological factors there. Now, besides that, you have structural factors. We are now talking about transactional sex work, and all that. Many women, and especially the young women, have chosen to go into this. I am not saying it's an excuse, and it's justified for them to do that, because when I was growing up, the young women I grew up with would do several other things to get money than to sell their bodies. Okay, so I'm not justifying it, but certain economic situations actually push some of these women into the kind of work they do, or into transactional sex. So it's structural. If we can address the issue of poverty, and unfortunately the statistics we've seen this week or last week from Statistical Service is not comforting at all. And so we need, as a country, we need to address the developmental challenges, the economic challenges. But unfortunately, that is a much broader area to talk about, how we fix that.
Is it likely that due to these structural reasons you've explained, that there might actually be more women having sexual intercourse with fewer men? As in, the men are perhaps more polygamous or, what's it called? More promiscuous. And so, but the women tend to go after only a few attractive men, financially attractive or whatever the case may be. Could that also contribute?
Yeah, I mean, women often would always want to see some returns from whatever engagement they have with a man. And so, to that extent, I would say yes. But the literature says that women are more promiscuous than men. And they have the ability to keep it under cover. Okay. You can hardly see it. But when it comes to HIV transmission in this country, it is more by men than women. Okay, so men are driving the epidemic in the country.
Yeah. Doc, I wish we could talk more. Our time has completely run out, but we're so grateful that you could spend such a big chunk of your morning with us. Dr. Chirme Ituahene, is the Director General of the Ghana AIDS Commission. All right, you can find out more about this from their website and also from our social media pages.